नमस्कार दोस्तों, गुड इवनिंग एंड वेलकम टू फर्टिलिटी दोस्त। लिट LIT, व्हाट एग्जैक्टली इज दिस? बहुत बात की हमने एंड आई थिंक आर दिस इज द थर्ड सेशन इन दिस लिट थेरेपी सीरीज विद डॉक्टर मुग्धा एंड थैंक यू सो मच व्यूअर्स फॉर दिस ट्रिमेंडस रिस्पॉन्स। बहुत अच्छा लगा जब बहुत लोगों ने कॉल करके मैसेज करके बोला दिस इज लाइक अ न्यू होप फॉर अस, बिकॉज कहीं ना कहीं इस ट्रीटमेंट में जाते जाते हम सब अपनी होप खो रहे थे, बट वेन एवर वी सी दीज सेशंस विद डॉक्टर राउत एंड इट इज लाइक ए यस, हमारे भी लिए कुछ है, वी कैन डेफिनेटली डू द थिंग्स बेटर। एंड इंटरेस्टिंग पार्ट ये है कि हमारे कुछ प्रीमियम मेंबर्स ने ट्रीटमेंट लिया and they got positive result also, though it's a very small period जहाँ हमने इस टॉपिक को इंट्रोड्यूस किया, हमारे मेंबर्स ने हमें बहुत अच्छा रिस्पांस दिया एंड व्यूअर्स ने भी इस चीज़ को बहुत प्रेज किया कि वी आर टचिंग द न्यू पोर्शन, न्यू पार्ट इन दिस फर्टिलिटी जर्नी। सो वंस अगेन थैंक यू व्यूअर्स फॉर सच ब्यूटीफुल रिस्पॉन्स। और अगर आप हमसे चाहते हैं और अच्छे सेशंस और टॉपिक्स रिलेटेड टू दिस न्यू टेक्नोलॉजी, देन प्लीज डू लेट अस नो। एंड टुडे सेशन इज रियली स्पेशल। स्पेशल इसलिए क्योंकि आई यूजली डू वीडियोज ऑन होप स्टोरीज, सो ये भी एक होप स्टोरीज हैं, बट ये थोड़ी हटके डिफरेंट स्टाइल की होप स्टोरीज हैं। एंड दीज आर नॉट होप स्टोरीज बाय पूर्णिमा, these are hope stories by Dr. Mugdha Rao. So viewers, please join and ask your queries. आज हम बहुत इंटरेस्टिंग टॉपिक पे बात कर रहे हैं, होप स्टोरीज, एंड होपफुली आप सबको देख के लगेगा कि यस, मेरे लिए भी होप कहीं ना कहीं पेंडिंग है। सो लेट मी फर्स्ट कॉल डॉक्टर मुग्धा ऑन द मेन स्क्रीन और फिर उनका एक छोटा सा डिस्क्रिप्शन फॉर ऑल ऑफ यू एंड व्यूअर्स। अगर आपने हमारे पहले 2 सेशन मिस किए हैं, देन प्लीज डोंट फॉरगेट टू वॉच देम अगेन। नमस्कार डॉक्टर मुग्धा, वेलकम टू फर्टिलिटी दोस्त।
Thank you,
Viewers,
Purnima.
thank you, ma'am. Thank you so much. Viewers, we have Dr. Mugdha Raut with us, and the topic is how LIT has solved complex infertility cases. और हमारे मुंबई के व्यूअर्स ने हमेशा हमें बोला कि थैंक यू सो मच मैम फॉर हैविंग डॉक्टर मुग्धा फॉर दिस सेशन। आई होप कि अब हमारे नागपुर, पुणे, दिल्ली, हैदराबाद, बैंगलोर, इन सब के व्यूअर्स भी हमें थैंक यू बोलने वाले हैं, because we Dr. Mugdha ke centers are live in these cities also, so viewers don't feel that Mumbai में नहीं है, Delhi में नहीं है तो कुछ मिस हो जाएगा। If you are in anywhere in India, please do let us know if you want to connect with Dr. Mugdha Rao. Teleconsultation is also available, and as Dr. Mugdha हमेशा बोलते हैं कि हमारा teleconsultation is as good as offline consultation, so please do that. एंड इंट्रोडक्शन की तो शायद मैम को जरूरत नहीं है, बट येस, डॉक्टर मुग्धा राव is a consultant gynec. She is a clinical reproductive immunologist, which is a quite new branch in India, and they have centers all over India. हम दुआ करते हैं कि जल्दी से सारे शहर में आए, and right now they have centers in Mumbai, Nagpur, Pune, Delhi, Hyderabad, Bangalore. And with her today we are going to discuss about, or rather we are going to talk about the hope stories by Dr. Mugdha Rao. So doctor, welcome to our session.
Thank you.
So ma'am, today we'll be talking about the complex infertility cases. So सबसे
Right.
पहला सवाल कि हम किसी एक फर्टिलिटी केस को हम ऐसे क्यों बोलते हैं कि इट्स अ कॉम्प्लेक्स केस, लाइक आपके इन डॉक्टर्स लैंग्वेज और आपके व्यूज में व्हाई वी यूजुअली कैटेगराइज दैट यस दिस केस इज अ सिंपल वन एंड दिस इज अ कॉम्प्लेक्स वन, सो व्हाट एग्जैक्टली इज दिस कॉम्प्लेक्स केस?
Yeah, according to us, a simple case would be where everything else is fine. पहली बार IVF के लिए जा रहे हैं या IUI के लिए जा रहे हैं, they are simple cases and everything is fine. But complex is probably where they faced a lot of challenges during the treatment also. किसी को endometriosis है, some have fibroids, some have multiple IVF failures, some have miscarriages after doing everything else. So this becomes a little bit of a complex case. And these are where we can call it as a complex infertility.
So we have many case studies for you viewers today. There are case studies where repeated miscarriages, they both natural and IVF. There are cases where repeated IVF failures, miscarriages, and when you are doing this IVF treatment and all that, तो इतना प्रेशर होता है हम लोगों के ऊपर, इमोशनल, फाइनेंशियल, सोसाइटी भी बहुत प्रेशर देती है कि यस यू आर गोइंग फॉर दिस एडवांस ट्रीटमेंट तो प्रेगनेंसी तो बनती है. सो आज हम डॉक्टर मुग्धा से उनके सबसे प्यारी और अच्छी 3 सक्सेस स्टोरीज, नहीं, rather we'll have 4 success stories with us today. So Dr. Mugdha, let's start. And first success story, कौन सी वाली हम डिस्कस करेंगे मैम? रिकरेंट आईवीएफ फेलियर्स एंड रिपीटेड मिसकैरेजेस.
Yeah.
ओके.
So I would like to tell this very nice incident when we had just started our center in Mumbai and our website was launched. And one day we got an email from Ireland. And that patient said that I saw your website, and she reported her entire history that she has had 15 miscarriages,
ओह.
of which 7 were IVF pregnancies and the remaining 8 were natural conception, and each time it ended in a miscarriage. And all her reports were normal. So she said, I think my body is rejecting my pregnancy. So she said, after reading your website, I was even convinced. And we would like to come to India for 8 days. We will get all the investigations done, which are done at your center. We will stay in India. We'll get the therapy and go back to Ireland. So the couple came to India. They got all the investigations done. And the investigations showed that LIT would be beneficial in their case. So she and her husband kept saying, yeah, we knew there is some rejection in her body. And we did her LIT. And now she has a baby boy. So if you can add the slides, I would
Yeah.
definitely like to show her photo.
So Dr. Mugdha, pregnancy finally was IVF or natural conception
Yeah,
only?
her pregnancy was a natural conception.
Okay.
And it went on very uneventfully for full 9 months, and she had a normal delivery also.
Great.
So I will just show her photo because this is the yeah.
Yeah.
So she is in Ireland still. They are an Indian couple in Ireland, and uh, she freely chats with all our patients who need help or need guidance about LIT therapy. She's sort of our brand ambassador now. So this is the case which I think was one of the earliest 15 miscarriages. And ever since, after this story, let me tell you that we have been trying to raise an awareness that we should start this treatment much earlier. Each pregnancy, each IVF, जैसे आपने बोला IVF किया तो pregnancy तो बनती है. So each for a patient, every treatment, every cycle is very important. So instead of allowing them to go for such a long period of miscarriages, it is always better that this awareness is created early on in life. Now, there is one more interesting case along with her. After 6 months, one couple came to our center and said, we want to do a sterilization. यानी हमें tubes बंद करने हैं, we don't want a pregnancy at all. So, as a routine part of the history, we said, how many children do you have?
Hmm.
And they said, we don't have any children. 14 miscarriages, so we remember. Every time she conceived, it results in a miscarriage. 14 miscarriages, we remember. But after that, we don't remember. And now we don't want to conceive. So we just suggested to them that why don't you try LIT?
Right.
And they had never heard about it, but they were very open minded. Surprisingly, means after so many miscarriages, they said, okay, we'll give it last try. And you she that couple conceived. We gave her LIT, and after I think 8 weeks, she conceived naturally. And now they
Mhm.
have a 9-year-old girl. They live in Uran. So
So
this was one of these earlier parts of the stories where it really touched our hearts.
right. So, Dr. Mugdha, here we have one query that after doing this LIT treatment, how many months or weeks gap should be there so that we can try for natural conception?
See, after LIT, one thing you have to remember ki if you need IVF, you need IVF. If you
Right.
are going to conceive naturally, you can, but you should wait for a minimum of 4 weeks for the body to undergo the changes which are associated with lymphocyte immunization therapy, for the body to develop the protection. So, 4 weeks is something which we have to look at. But and the effect of the therapy, the way we do it a single sitting, a 3 hour procedure. The effect of this therapy, you have to remember, lasts for 18 to 24 months. So अगर by chance कभी delay हुआ, 4 weeks से ज़्यादा delay हुआ, and you're planning a pregnancy after 6 months, so the effect will now, you don't need another LIT after 6 months. The effect lasts for 18 to 24 months. So you have a good time period in hand before you can plan the pregnancy
Plan.
or do an IVF. Yeah. But
Right.
minimum first 4 weeks may you are supposed to wait.
First week. Right. First 4 weeks.
Yeah.
So, exactly 1 month we can say that we have to
Yes,
wait.
yes, yes.
Right. So, viewers, if you are unable to log us on Facebook, then please don't worry. Right now, we are live on YouTube also. जी हाँ, हम Facebook पे भी हैं, YouTube पे भी हैं. आप किसी भी सोशल मीडिया पे जाके हमें देखिए, बिकॉज बहुत सारे व्यूअर्स ने बोला कि हमारे पास तो फेसबुक है ही नहीं. सो हमने सोचा चलिए हम और आप यूट्यूब पे भी ज़रूर मिलते हैं. सो आई रिक्वेस्ट एंड सजेस्ट प्लीज़ आप यूट्यूब पे भी लॉग कीजिए so that you can watch this live video over there also. So, Dr. Mugdha, we have one more query where people are asking that miscarriages is very common problem nowadays. So, could you please highlight what could be the reasons for this?
Yes, okay. So see, the commonest, all the reasons for miscarriage, let us enumerate. Uh, we look at genetic causes. So genetic cause, if there is a genetic problem in the parents or in the embryo. The second, we look at anatomic or structural. That is whether the uterus has any, say, fibroids, septum, polyp, or whether it has any other unicornate uterus. So these are the things which could increase the chances of miscarriage. Also, there could be defects in the sperm. So you have to remember that also. The sperms are equally important. Structurally, when we say only, it's not only the uterus, it's even the sperms. Then we look at the third cause is the hormonal causes. The hormonal causes are like if you have uncontrolled hypothyroidism, or your prolactin hormone is high, or if you have polycystic ovaries, then the chances of uh, miscarriage or even IVF failure increases. The next cause which we look at is any infections. Now, infections are mainly rubella is something rubella viral infection can cause. And yes, tuberculosis of the uterus can definitely cause IVF failures or even miscarriages. The next which we look at is any systemic disorder, metabolic we say, means uncontrolled agar diabetes hai, uncontrolled hypertension hai. See, if it is controlled, a woman can carry the pregnancy. But if it is
Right.
uncontrolled, then it will result in a miscarriage or a IVF failure because the blood supply to the uterus gets compromised. Now, the next factor which we look at is any clotting disorders. We call thrombophilias. Thrombophilias can be congenital, means by birth, which are quite rare, but also there can be acquired. Now, these thrombophilias cause excessive clotting of the blood. So the blood vessels to the pregnancy itself are so narrow. कि if there is clots formed in it, then the pregnancy will not grow properly. So if there is a thrombophilic disorder, the chance of miscarriage definitely increases. So these are the causes which account for about 40% of the cases, and the remaining 50 to 60% of the cases which are called so-called unexplained, are mainly immunological rejection of the pregnancy. So what we are talking about lymphocyte immunization therapy is testing for is alloimmune rejection of pregnancy, because any pregnancy is 50% mother and 50% father. So
Right.
50% of the father's genetic material is foreign to a mother's body. And we all know that our body doesn't accept, हमें कुछ भी foreign accept नहीं करती. Like it will not accept any infection. It will not accept mismatched blood transfusion, liver transplant, kidney transplant. But pregnancy is one thing which the immune system treats differently from the rest of the body. So as soon as the pregnancy enters the uterus, there are certain blocking antibodies which cover the uterus and do not allow the immune system to come and attach to the uterus. This is called as immune tolerance.
Tall.
And plus, there are T regulatory cells which help in the immune. They tell the immune system, यहाँ पे मत आना, इधर हाथ नहीं लगाना, and the pregnancy grows to term. Now, in some patients, this immune protection is not formed. So these are the cases where we test them with all the tests like lymphocyte cross match, natural killer cells, TNF alpha, anti-thyroid antibodies, and we come to a diagnosis whether alloimmune rejection of the pregnancy exists or no.
Okay.
So
Right.
these are the causes, we can say, of miscarriages and IVF failures also, because there has been a recent paper, it's published in the Austin Journal, where they have said that uh, the causes of IVF failure and miscarriage are the same. They have proved that, because all the causes which are responsible for miscarriages can also cause IVF failures.
Okay. So we cannot discriminate, like
Yeah.
ये है तो इस वजह से हो गया, और ये वाला रीजन, ये नेचुरल प्रेगनेंसी इसलिए खराब हो गई. सो
हाँ,
द
हाँ.
रीजंस, राइट.
And sometimes all factors can coexist also. So that's why we are trying to spread the awareness that try to think about this early.
Right.
Don't wait for a very long time to allow them for 4 or 5 failures, and then you think after 2 failures itself. Start investigation at the second failure itself, where you look at the genetic and all other investigations.
Right.
So this is I yeah.
So I think this is the right approach, because हम बहुत साल, I would say that many years we waste just because कि try it will happen. I know लोग भी यही कहते हैं कि try you will succeed. This is like a very common thing. But यहाँ try के बीच में थोड़ा रुकिए, थोड़ा इन्वेस्टिगेशन कीजिए, देन अगेन ट्राई, एंड वी बिलीव कि रिजल्ट जरूर आएगा. So, Dr. Raut, we'll go for second our success story. So let me just add this. Okay. Yes, ma'am.
Yeah. So now this success story is extremely unique. Uh, this patient, she had IVF done 5 times. Okay. And every time she used to conceive. She used to conceive with self cycle, she used to conceive with donor cycle also. And each pregnancy went to 5 weeks and 6 days. Means sometimes she calls herself, I am your 5 week 6 days pregnancy. So she was referred by her gynecologist to us, and after listening to the whole story, her whole history, everything was done for her. Her era was done, everything possible was done. So when she was referred by her gynecologist, we tested both the couple, and we found out that lymphocyte immunization therapy would be beneficial in this couple. So they immediately agreed, and they decided to undergo this LIT. They underwent LIT, and unfortunately for them, COVID happened. So that 4 weeks window went away. Like, after 4 weeks, they had to plan the IVF. So I said, don't worry, that effect will last for 18 to 24 months. You don't have to worry at all. So when the government began to allow IVF, they went in for the IVF. They had their embryos frozen, and she conceived in the first cycle itself again. Now the challenge was again 5 weeks, 6 days. So one day I remember they came to the clinic and they both were sitting and they were crying. So I was like, kya hua? Means I was a little surprised. Have they done the sonography? What has happened? And then they saw my husband and me, they both fell at our feet. And we said, what happened? Like we were completely unaware. They said, for the first time in our lives, we saw the heartbeats of the babies, and we have twins. So this is the picture of the twins, which I've shown in this. And she went on to deliver. She delivered preterm at 32 weeks because they were twins, and mouth of the uterus opened preterm. But
Hmm.
both the twins are absolutely fine. They have been going to school, and even she has put up her review on our Google review page, on the ICPRM page, where she has this written about it. She has put up the photos of the baby, and till today she keeps sending us videos when the babies are going. Now they're going to the nursery, so she has sent videos that they both are going, how they are talking. So she said, I never would have, we would have never seen this day if y'all did not exist to do the LIT.
सीरियसली सच में ये बहुत इंटरेस्टिंग है बिकॉज I don't know why it's been like almost 16 years, but till date I could correlate with this twin pregnancy because I lost my twins in 24 weeks of my pregnancy. So it's like कि अभी भी अगर मैं सोचूं तो मुझे लगता है कि आप मुझे मिल जाते तो शायद सब बच जाता, बट डेस्टिनी. सो
Yes.
आई थिंक बहुत सारे ऐसे कपल्स हैं जिनका होप आपके साथ है. व्यूअर्स प्लीज डोंट फॉरगेट कि होप हमेशा है, चाहे वो आपका आईवीएफ स्पेशलिस्ट दे रहा है, चाहे वो आपके रिप्रोडक्टिव इम्यूनोलॉजिस्ट दे रहे हैं, चाहे हम एक सपोर्ट ग्रुप दे रहे हैं, बट आप अपना होप ज़रूर इसी तरीके से कायम रखिए. So, Dr. Mugdha, next question we have this raised NK cells. बहुत लोगों ने ये पूछना चाहा कि when doctors just say कि आपके NK cells raised हो गए हैं, killer cell raised हो जाए, एक टेंशन आ जाता है. So, what exactly is this and how they harm us?
Yeah. So see, NK cells means natural killer cells. जैसे हम बोलते हैं natural killer means the body has them in there to kill infection, to kill any mismatch, as we say, transfusions or anything which is foreign to a body. Now, NK cells, the way they are used as natural killer, there are a part of NK cells which even protect the pregnancy. So whenever we say NK cells are raised, yes, this patient has a high chance of immune rejection, but we also have to look at their percentage of the immune tolerance cells, which is CD16 plus 56. So high NK cells is definitely a probability that you have immune rejection and you will benefit with lymphocyte immunization therapy. So high NK cells agar hai, don't lose hope. We complete the other tests which are required, like lymphocyte cross match, TNF alpha, antithyroid antibodies. We arrive at a diagnosis, and you take the lymphocyte immunization therapy. Wait for 4 weeks. Don't rush into another IVF or another pregnancy naturally if you're trying. Wait for it. After you conceive, there will be a protocol, individualized protocol, which we will give you and share with your doctor for passive immunomodulation. So I think this is what raised NK cells. There is no need to get scared about raised NK cells. Our body needs NK cells to fight infection. But if the balance of the NK cells which protect you are less, then there is a high chance of immune rejection, and there is definitely a treatment to raised NK cells.
डॉक्टर मुग्धा, आई हैव वन मोर क्वेश्चन, बट आई थिंक सबसे पहले हम एक और सक्सेस स्टोरी देखते हैं. सो
Yeah.
एक मोटिवेशन फिर से लेते हैं कि यस, अगर उन्होंने किया तो हम भी कर सकते हैं. So let me just start sharing the screen. Yes, doctor. Third slide, right.
Yeah, yeah. Okay. So this patient is, I must tell you her history that she had, like, this is written in short. She had 3 IVF cycles done. Then she was diagnosed with endometriosis. And because IVF cycles had failed, the endometriosis was diagnosed. She was treated for endometriosis. She underwent 2 surgeries for endometriosis. And then the patient developed some allergy. So she was for a long time on anti allergics and all. And then again, she underwent again a chocolate cyst had to be removed. And then again, an IVF cycle failed. That's when her doctor referred कि नहीं आप इनके पास जाके just get all the tests and if required get the therapy done. So very nice couple, and they came to us, and of course all couples are very nice. They came to us and they said that ऐसे ऐसे this is our situation. I have endometriosis. Can you help me? So see, endometriosis. What is endometriosis? Endometriosis is uh, how you bleed outside every month, you bleed inside also. Now, every woman bleeds inside during her menstruation, but the body takes care and destroys that blood. But in those women where the body cannot take care of it, the endometriotic tissue remains and it keeps, then it goes to stage 1, stage 2, stage 3, and stage 4, and then it can cause infertility. And the natural killer cells also can be raised in endometriosis. We did all the tests for this couple, proved that LIT would be beneficial for them. They underwent LIT. And first cycle after LIT, again, she conceived twins.
Great.
So, and she delivered at a full term pregnancy, uneventful, no high blood pressure, no diabetes. इसके साथ the delivery was also not preterm, but everything went off very smoothly. And her twins, I mean, she's regularly in touch with us. So this is how I would like to say that, even if you have endometriosis, whether you're doing IVF or planning naturally, do think of LIT before you plan the pregnancy. Because apart from this, I will tell you one very interesting story. I mean, we have many endometriosis cases, but one very interesting story. One was referred to us from Nagpur, and she'd undergone 4 surgeries for endometriosis. Now, her doctor said that they did IUIs, so her IUI failed 3 times. And then the doctor said that no, I think before we start IVF, you do a LIT and come to me. So she said, okay, I'll do LIT. And sorry, she had undergone one IVF and then the doctor referred for LIT. So we did her LIT. She was going to go in for IVF. So kuch hua and she had to wait for 2 months at least. And in that interim period, she conceived naturally. She had
Great.
3 failed IUIs, one failed IVF, 4 surgeries for endometriosis, and she conceived naturally. And trust me, when her cesarean was done for the delivery, she delivered full 9 months. The Her doctor called us up very excitedly and said, she delivered. And during the cesarean, there was no endometriosis.
Wow.
So, this is the power of immune treatment, using your immune system to help your own body. And then one day we get a call from message from the patient that now I have again conceived naturally, second time.
Wow.
So, do
Great.
I need any treatment? Do I need to come for LIT? So we said, no,
Mhm.
just the body will take over. You just carry. And she delivered again a health. The first was a girl and the second was a boy.
Great.
So
So,
this is science, which is, I think you should think of the power of science where the immune system definitely can help your own body to help yourselves.
right. And I usually call endometriosis as very stubborn disease. मैं किसी को भी होता है तो मैं बोलती हूँ कि एंडोमेट्रियोस आपसे बहुत प्यार करता है. सो
Yes,
प्लीज आप
correct.
उससे कम प्यार कीजिए. सो
Right.
इन केस अगर आप लोगों को लगता है कि एंडोमेट्रियोसिस आपसे बहुत प्यार कर रहा है, देन डोंट फॉरगेट टू विजिट डॉक्टर मुग्धा. वो देखेंगे कि कितना प्यार कम किया जाए.
Exactly.
Uh, so, doctor, one important question, we have one query here related to ANA because AMH is a very common thing. सबको पता है, गूगल किया खट से AMH इतना है, ओ हो मेरा तो टाइम खत्म हो गया, प्रेगनेंसी नहीं होगी. बट व्हाट अबाउट दिस ANA? बिकॉज nowadays doctors are asking about this test. Patients भी थोड़े से what you call ke they really need to know more about the things that could impact their pregnancies or their conception. So what exactly is ANA? और आप क्या सजेस्ट करोगे अगर किसी को ये ANA का इशू आता है तो?
Is it AMH or ANA?
ANA मैम, ANA, ANA.
ANA.
हाँ
ANA.
जी, हाँ
So,
जी.
ANA are anti-nuclear antibodies. Now, these patients, this means that now there is a range of it. Anti-nuclear antibodies, when they are present, indicate some form of autoimmunity. What is autoimmunity? Is your body reacts to your own tissue. Okay. So autoimmunity, now when we test for it, we have to do it once and then repeat it again after 6 weeks to confirm that the ANA is raised. So anti autoimmunity and alloimmunity many times coexist together. So whenever a patient has ANA positive, there is a chance of miscarriage because of the autoimmunity. We see the level. How much is it? Just 1+ is okay, there's nothing to worry about it. But if it is a little in the higher range, then autoimmunity will exist. But such patients also should look at alloimmune causes because autoimmunity and alloimmunity exist. So definitely get yourself tested along with that for your lymphocyte cross match, natural killer cells, TNF alpha, anti-thyroid antibodies. And if we treat both of these together, then definitely the chance of the success of the pregnancy is going to increase. So ANA is anti-nuclear antibodies to our own. कोई भी cell में there is a cell and there's a nucleus in between. So these antibodies are antibodies to that nucleus, inner nucleus. So nucleus is always required. It is the energy house of the cell, the powerhouse. So if they're going to be antibodies destroying it, definitely pregnancy is also a part of cells. So it is going to destroy it. So, but these two have to exist. So you have to treat accordingly.
So, doctor, we have one more query that if my doctor is not suggesting any kind of such test, should I myself can consult a doctor and do the tests?
I think definitely you must do the test. As I said, there are many causes of repeated miscarriages. And we feel that the early on you do it, you know,
Hmm.
it is always better. So it's always better to consult a doctor, get these tests done, which are required for you, which have been done. You don't need, like karyotype doesn't need to be repeated every time. But
Right.
other tests, definitely, which are required, must be done and get yourself treated on time. I'll tell you, I remember I had one patient who had seen our video, and I was talking about the investigations which are required for before lymphocyte immunization therapy. उसमें हम endometrial CD57 भी करते हैं when we are doing a hysteroscopy. So her endometrial, I had done her hysteroscopy and we did her endometrial CD57, and she was seeing the video, and I before I entered the clinic she had already got her report. I had not seen the report till then. So she and her husband come into the clinic and say, see, I need LIT. So I said, why? What? My CD57 is positive and आपने video में बोला कि if it's positive LIT is required. So I said, yeah, definitely it is required. So, and she said, I'm going in for IVF. I want twins in the first place. I'm not going to wait. First pregnancy they were planning for. So we did her LIT and then she conceived in the first cycle with twins. So because she had unexplained infertility, so we had to do all the tests.
Right.
So, and then subsequently, when her daughters were 8 months old, she conceived naturally again without IVF.
Wow.
So, I mean, how the immune system works and how the body takes over. So, I think definitely you must consult a doctor, get the test done, even if your doctor says, we talk to the doctor and tell them that just a minute. Huh?
Hmm.
We talk to the doctor and we tell them that this is what we would like to do. Get the test done. Talk to them, uh, and then we will help you with LI.
So, doctor, we have queries related to these tests and all that.
Yeah.
So, आपको क्या लगता है कि अगर हम प्रेगनेंसी प्लान कर रहे हैं, like I'm planning that yes in next 3 months I'm going to plan for this. So, शुरू में टेस्ट करवाना ठीक है और otherwise I'll just try for 6 months और अगर कुछ नहीं हो रहा है then I should consult a doctor, then I should go for these specific tests and all that.
Yeah, see, this is a very important question, but we feel that uh, you must only do the basic test to plan the pregnancy before you plan the pregnancy. So then try for 6 months. If not, you don't conceive after 6 months, then you go in for other tests like the tubal test,
Mhm.
sonographies, husband sperm count. You get your thyroid. Of course, आजकल we do all these tests. Even the husband sperm count we do it before they plan the pregnancy only. So many of the tests are done. Anything like diabetes, everything gets treated. PCOD gets treated. So
Right.
I think always we start with the basics. We should always
Yeah.
start with the basics, and then go in. And agar uh, you don't conceive after means or you have a miscarriage. You are above 35 and you have a miscarriage, or you do the IVF and the first pregnancy results in miscarriage. Then definitely you must do these tests early.
So there are always timelines for these tests and
Yeah,
I believe कि अगर हम शुरू में इतने टेस्ट करवा लेंगे तो हम खुद से बहुत पैनिक क्रिएट कर रहे हैं अपने लिए. So
absolutely.
don't do
And I think
that.
you get scared. So I think you trust your body, trust God. Like one of my very dear friend tells, she's an IVF specialist. He always tells the patient, trust your body, trust God. सब ठीक हो जाएगा.
बिल्कुल. And I think this is trust is really important when you are in this fertility journey because अगर आप अपने डॉक्टर को ट्रस्ट नहीं करते then there's no use of taking such treatments. So डॉक्टर हम आते हैं नेक्स्ट आपकी सक्सेस स्टोरी पे. So I'll just I think next one, right?
Next one, yeah.
Hmm. Yes.
Yeah. So, this story I would really like to say why we took it is that this is a success story, one of the success story of LIT when we are done in pregnancy. Now, when we look at immunological rejection of pregnancy, there can be various aspects like unexplained infertility, IVF failures, miscarriages, but also early development of high blood pressure in pregnancy and loss of a baby are extremely important, can have an immunological basis. And this is one patient who had two pregnant, who had, she had, she lost her baby at 6.5 months twice because of high blood pressure. Uh, Now, everything was done. Her hysterectomy, I mean, all her investigations were done. Everything was normal. She used to conceive. So she had lost her baby thrice. So fourth pregnancy, the couple traveled all the way from Parbhani, and she was 3 months pregnant. They took a halt, and then they traveled to Mumbai. She took LIT in pregnancy, and she had a completely uneventful pregnancy. And this is the baby boy who was born to them. So she had a cesarean towards the end, because and but 37 weeks she delivered, and baby was absolutely fine. So they kept the baby in NICU only for observation. She delivered in Parbhani, it's in Nanded. She delivered in Nanded. So this is one success story where LIT can be given in pregnancy. So early pregnancy, late pregnancy losses, preterm deliveries, and even late pregnancy losses are can have an immunological basis. So keep an open mind. There are sudden IUFDs which happen, sudden intrauterine deaths which happen, which can have an immunological basis. So we would really like to say this because we've not. This is not. This is the 10th case in pregnancy which we have done. Recently, one patient delivered who uh, came to us 6 weeks pregnant, and she said, "Do you want me to abort now?" And this is not only she. Every patient who came in pregnancy asked, "Do you want me to abort?" One patient was sent in an ambulance to us by a doctor. She was bleeding. And they said, "We have done everything. Nothing is possible. Please do her LIT." Her investigation showed she had a raised TNF alpha. She was sent in an ambulance from Mira Road to our hospital. We admitted her, did her LIT, and then we sent her back. And then she delivered normally after 4 miscarriages. So don't lose hope. Even in early pregnancy, LIT can be done, and you can avoid miscarriages. And means don't wait to ask me the question, "Do you want me to abort again?" It is a very very sad question which patients ask, and they
Right.
are willing to do anything because they've had 5 miscarriages, 6 miscarriages. But yes, we do the tests. We confirm that LITs would be beneficial, and then we do the LIT.
Right.
So it's not like इतने miscarriages है तो करना ही है, is not like
करना
that.
है. Right. Doctor, it's just that if the patient is having hypertension issues, then LIT can also help.
Yes, yes.
Okay.
Hypertension in pregnancy. It's
In
called pregnancy
pregnancy.
induced hypertension.
राइट. बिकॉज मेरे पास रिसेंटली एक केस ऐसा है जिसका अनफॉर्चुनेटली अभी एबॉर्शन हो गया जस्ट बिकॉज ऑफ हर रेज्ड हाइपरटेंशन इश्यूज एंड प्लस उसकी वजह से उसके प्लेटलेट्स डाउन हो रहे थे.
Correct, correct.
So, what you suggest, I'll definitely discuss this with her. So, I just
Yes.
want to know कि after how many months she again can plan her transfer. उसका IVF process है. So, I would
So she
definitely
needs to
connect that person to you. But
definitely.
after how many months she can plan the things
See,
again?
this patient first needs to completely recover because in na liver function also gets affected. So everything needs to come back to normal. Then we investigate her for
Mm-hmm.
possible causes, and then do the LIT. So I think it takes about 6 months for such patients to actually plan the next transfer, because they have to come back to normal health, because mother's health is most important. So
Right.
mother's health has to be normal. Then we do the test, then we do the LIT. Then 4 weeks later on, we ask them to plan the pregnancy. So it embryo transfer or naturally plan the pregnancy, and then uh, they can. But of course, and they are under our supervision for full 9 months. Supervision means with their doctor, because we don't
Right.
do IVF, we don't do deliveries, we don't do this. We only do reproductive immunology. So we are in conjunction with the help of the doctor. We administer, because हमें तो हर जगह patients can't keep coming to us. So where even
Right.
if they are in Delhi, Bangalore, wherever they are, Assam, Mizoram, wherever, we tell the doctors, we give them the list, and we help them to help the patient.
Right. I'll definitely connect that patient with you because ये अभी recent case है and it was like हम सबके लिए बहुत बुरा एक्सपीरियंस था. प्रेगनेंसी, आईवीएफ प्रेगनेंसी, प्रेगनेंसी चाहे कुछ कोई भी हो, नेचुरल कंसेप्शन है, चाहे आईवीएफ है, इट्स जस्ट कंसेप्शन एंड अगर कुछ बीच में होता है सो इट्स रियली वेरी बैड फीलिंग फॉर ऑल ऑफ अस. सो व्यूअर्स, अगर ये छोटी चीज आपको लगती है, आपको लगता है हाइपरटेंशन ही तो है, फिर क्या हुआ, प्रेगनेंसी में तो ये हो जाती है और ठीक भी हो जाएगी, मैटर ऑफ फ्यू डेज, फ्यू वीक्स और फ्यू मंथ्स, सब कुछ ठीक हो जाएगा. देन प्लीज डोंट टेक सच थिंग्स इजी. आप बात करके देखिए आपके डॉक्टर के साथ, हो सकता है ये सिचुएशन एग्रीवेट हो जाए और हम नहीं चाहेंगे कि जिसको आपने इतना छोटा सा समझा वो सिचुएशन आपकी पूरी प्रेगनेंसी को खराब करे. सो प्लीज बी अवेयर ऑफ योर बॉडी चेंजेस. प्लीज बी अवेयर ऑफ द न्यू थेरेपीज, न्यू टेक्नोलॉजीज, जो भी नया कुछ आ रहा है उसके बारे में ज़रूर जानिए. हम ये नहीं कह रहे कि आपको इसकी ज़रूरत पड़ेगी, हो सकता है आप इसको किसी और के साथ शेयर करके उसकी हेल्प कर पाएँ. So doctor, one more story, let's discuss it. आई थिंक हमारे व्यूअर्स को भी बहुत अच्छा लग रहा है, वी कैन हैव दिस, यस, सो आई थिंक
Yeah.
दिस वन, राइट?
Yeah, this is the story. This is the story of whom I said she has twins now, the 5 week, 6 days
ओके,
pregnancy. And she's
हाँ
also,
हाँ,
you read her review on our Google page. Now, this couple,
हम्म,
they had two late pregnancy losses at 8 months. And
ओके,
uh, uh, sorry, one was at 6 months and one was at 8 months. And she had no high blood pressure. And suddenly the pregnancy used to just, heartbeats used to just stop. All investigations are done, everything is normal. And when they were referred for LIT, we explained to them her investigation showed definitely she needed LIT. And we explained to them that this would be required. So, means that time it was, they thought it was only for, everyone used to think it is only for miscarriages and IVF failures.
राइट,
So we explained to them and they were willing. They said, no, we will give it a try because I have nothing to do now. I have no hope left. So they did it, and she delivered completely uneventfully at a proper 38 weeks of pregnancy. And this patient, and I tell you, we remember them so much because, she used to come in a hospital and check the heartbeats regularly. इतना ये हो गया था उसको, 6 months में हुआ था पहले, तो हार्ट बीट्स देखो, एवरी दे आस्क्ड अस कैन वी कम एवरी डे एंड चेक द हार्ट बीट्स. So, they, and then she delivered, she had a cesarean, she delivered by and then they had come to show us the baby when the baby was 8 months old. So this is an extremely very special case which I would really like to share. She had late pregnancy losses, no high blood pressure, but immunological cause was there. So there is hope, even if all the reports are normal. It is extremely disheartening to lose a baby that late. So it is so it is better that, I mean, as you said rightly, Purnima, new technologies are coming up. Learn about it, and definitely if they are good and for you, then you must definitely think about it. And this slide is, I have tried to make a collage of all possible. Like, we have done more than 2,500 cases, so I've tried to bring in as many this as I could, but I think they are not all the 2,500. But this slide comes as a thank you from all the patients who trusted us, their doctors who believed in us and sent them for LIT to us. So this comes as a thank you from them to us and from us to them. Also, thanks for trusting us.
दिस इज रियली, आई थिंक वो एक वर्ड आई रियली वांट टू से मस्त एकदम, सो इस सच में इट्स रियली नाइस, बिकॉज हम हर बार सिचुएशंस, प्रॉब्लम्स, इन सब चीज़ों को शेयर करते हैं, बात करते हैं, बट व्हेन वी टॉक अबाउट दिस सक्सेस स्टोरी, सो होप, आई थिंक होप इज रियली इम्पोर्टेंट ओवर हियर, और हमारे व्यूअर्स के भी बहुत सारे हैं, नाइस, सुपर, रियली इट सीम्स, yes, so I must highlight few messages. Really, it seems very loved when something happen, then nothing. It is, I think, no words, but yes, thanks for sharing, doctor. Seriously, आपने हमारे सारे व्यूअर्स का दिन बनाया, दे आर सो हैप्पी, बिकॉज ये बहुत छोटी स्टोरीज हैं, अगर हम इनको सोचे समझे, अच्छा ऐसे था, ऐसे हो गया, इसमें क्या था, बट अगर हम उसको रियल लाइफ में सोचने की कोशिश करें, देन दे आर रियली टफ स्टोरीज, बिकॉज जिसके साथ हुआ है, जिसने इतने मिस कैरेजेस सोचे समझे हैं, उसके लिए इट्स वेरी डिफिकल्ट. एंड हेयर आई मस्ट से कि थैंक यू सो मच फॉर गिविंग hope to our viewers, and viewers, please don't forget to this share this session. And ये हमारा थर्ड सेशन है वी हैव 3 सेशंस सीरीज विद डॉक्टर राउत. आप सारे एपिसोड ज़रूर देखिए, बिकॉज हर एक एपिसोड दूसरे सीरीज से एसोसिएटेड है. एंड यस, अगर कुछ प्रॉब्लम है तो उसका सॉल्यूशन ज़रूर है, मुश्किल है तो हल भी है. लेकिन ज़रूरत सिर्फ इतनी है कि आपको कोशिश करनी है कि आप उस मुश्किल को या आप उस प्रॉब्लम को किस तरीके से अपने आप को उसमें से निकाल सकते हैं. सो डॉक्टर मुग्धा, इट वाज लाइक बहुत बढ़िया सेशन.
Thank you.
जस्ट फ्यू पार्टिंग
Words.
नोट फॉर आवर व्यूअर्स.
Yeah, first, though, no, I would like to thank Fertility Dost and Purnima for you all for giving us this opportunity to spread the awareness. You know, the purpose of this whole thing is that people should be aware about it so that they can do something early. The frequent question which is asked was, why was it not told to us early? Why did I have to
Right.
go through this? Do you want me to abort? Do you going to wait for me to abort again? So this program, you know, was all the 3 sessions were something used to create an awareness so that more people come to know. They ask their doctor, the doctors can connect with us if they have more patients. So as a community, we can help more people to achieve a baby. Of course, we always tell everyone we are not God. This is
Right.
science which we help you. So ultimately everything is in God's hands. We help you with, in selected cases we have a success rate of 75 to 80%. We also, suppose kisi ka nahi hua, we call them up again, we try to find out new research is happening, we can get to find out what could be done additionally for them. So I'm really grateful to you all for allowing us to be on this platform to spread the awareness. So our aim is basically to help people, like you all have a this to help people, as you call it, fertility those. Our aim is absolutely the same, that more people should be aware, we should help them, and they should spread the word. So kisi ko zarurat ho, you know, not only them but someone else needs it, then they come to know. Now all the success stories which I guess, some patients didn't want to come forward, it's okay, that is their personal choice.
Right.
Some patients are definitely open. We have a YouTube channel where we have something called the LIT show, where patients who are willing to talk, they have actually spoken in the show for almost an hour and told their whole story in that. So if anyone wants to see, you can see the LIT show in the on our YouTube channel. There are doctors who have referred to us and how they have benefited from it. So uh, I mean, I would really like and really thankful to you.
थैंक यू डॉक्टर, एंड थैंक यू व्यूअर्स फॉर जॉइनिंग दिस. भूलिए मत, ये यूट्यूब पे भी लाइव था और वहाँ पे भी सेव रहेगा. हम किसी ना किसी तरीके से अवेयरनेस ज़रूर फैला सकते हैं. जस्ट अ शॉर्ट 2 मिनट छोटा सा एक इंसिडेंट. फ्यू डेज बैक आई वाज विजिटिंग वन एग्जीबिशन, बिकॉज फैमिली में शादी है, सो माय डॉटर जस्ट वांट टू बाय सम फैंसी थिंग्स एंड ऑल दैट. वहाँ पे आई वाज जस्ट टॉकिंग टू वन ऑफ माय टीम मेंबर, तो जो जिसका स्टॉल था उसने पूछा, मैम व्हाट एग्जैक्टली यू डू. सिर्फ मैंने उसको बताया कि हाँ मैं ऐसे ऐसे करती हूँ, आप नंबर दे दीजिए. यस. नेक्स्ट डे उसने अपनी एक कलीग को नंबर दिया मेरा. शी कनेक्टेड एंड हमारी बात हुई. आई टोल्ड हर कि ठीक है, शी वाज एक्चुअली लुकिंग फॉर अ गुड आईवीएफ डॉक्टर. आई कनेक्टेड हर टू माय नोन डॉक्टर एंड स्टिमुलेशन और सब. एंड नाउ शी इज रियली हैप्पी, बिकॉज 2 फेल्ड आईवीएफ थे उसके, और उसके कभी भी अच्छे एम्ब्रियोज नहीं बने थे. इट्स जस्ट दैट आई रेफर्ड हर टू द डॉक्टर. उसके एम्ब्रियोज अब अच्छे बने हैं. अभी ट्रांसफर
Wow.
नहीं हुआ, बट अगेन इसी उस पे शी इज हैप्पी कि मुझे अच्छा डॉक्टर मिला. तो तभी पता नहीं एग्जीबिशन में कहाँ से कोई मिल जाए, बट प्लीज आप सोसाइटी के लिए जितना कर सकते हैं जरूर कीजिए. क्या पता किसी की दुआ आप पे भी लग जाए. बी अवेयर. थैंक यू व्यूअर्स, थैंक यू डॉक्टर,
Thank you
थैंक यू
so
फॉर
much.
जॉइनिंग. थैंक यू.